Welcome to week 4 of pregnancy, a major milestone as you officially miss your period and might confirm that you're expecting. Whether you're trying to conceive or already aware of your pregnancy, understanding the symptoms and what to do in week 4 is key. In this video, we'll break down everything that's happening inside your body, common symptoms you may experience, and practical tips to help guide you through this exciting time. During week 4, significant changes are happening at a cellular level. By this time, the fertilized egg has successfully implanted into the lining of the uterus, and your baby is officially starting its development. This is the point when pregnancy hormones like HCG begin to surge. The placenta and amniotic sac are also starting to form, supporting the baby throughout your pregnancy. Right now, your baby is the size of a poppy seed, and though it's tiny, your body is already working hard to nurture and protect it. Common symptoms at week 4. Now that the pregnancy is progressing, you may begin to notice more physical signs. Here are the common symptoms you could experience in week 4. For many women, a missed period is the first real indicator of pregnancy. If your cycle is usually regular, this could be one of the strongest signs. As your hormone levels start to rise, particularly progesterone, you might feel unusually tired. It's normal for your body to use extra energy to support the growing pregnancy. Due to increased hormone production, you may experience breast tenderness or swelling. This is your body's way of preparing for milk production in the future. Some women may begin to feel mild nausea or morning sickness as early as week 4. Although it's more common in later weeks, it can start early for some. Hormonal changes can slow down digestion, leading to bloating or gas. It's another early symptom many women experience in the first trimester. Hormonal fluctuations can affect your mood. You might feel emotional highs and lows during this period, which is completely normal. What should you do in week 4? Week 4 is a crucial time to make healthy choices that benefit both you and your baby. Here are some important steps you can take to support your pregnancy during this stage. It's a good time to call your doctor or midwife to schedule your first prenatal appointment, which will likely take place around week 8. They can provide you with crucial health advice and order early pregnancy tests if needed. Continue or start taking prenatal vitamins, particularly those that include folic acid. Folic acid helps support your baby's early brain and spinal cord development and reduces the risk of neural tube defects. Focus on a diet rich in fruits, vegetables, lean proteins, and whole grains. Include foods high in iron, calcium, and folate to support your baby's development. Make sure to drink plenty of water throughout the day to stay hydrated. Proper hydration supports your increased blood volume and helps transport nutrients to your baby. At this stage, it's critical to avoid alcohol, tobacco, and any drugs not prescribed by your healthcare provider. These substances can interfere with your baby's development. Since fatigue is a common symptom, allow yourself plenty of rest. Listen to your body and prioritize sleep when you feel tired. While many symptoms are normal, if you experience heavy bleeding, severe cramping, or unusual discharge, contact your healthcare provider right away. Common misconceptions about week 4 pregnancy. There are many misconceptions about the early stages of pregnancy, especially around week 4. Let's clear up some of the most common ones. Some women believe they shouldn't feel any symptoms this early, but many symptoms can start around week 4. Everyone's body reacts differently, so if you feel changes, trust your instincts. If you take a home pregnancy test and get a negative result, it doesn't necessarily mean you're not pregnant. HCG levels may not be high enough to detect yet. Wait a few days and try again. Despite the name, morning sickness can occur at any time of the day or night. If you're experiencing nausea, try eating smaller, more frequent meals. Common question about week 4 of pregnancy. Now, let's go over a few common questions that many women have about week 4 of pregnancy. Can you take a pregnancy test in week 4? Yes, you can. By the 4th week, home pregnancy tests can typically detect HCG in your urine, but if you get a negative result, wait a few days and retest. When should you call a doctor? If you experience unusual symptoms like heavy bleeding, severe cramping, or pain, it's important to call your doctor right away. Otherwise, you should schedule your first prenatal visit within the next few weeks. What foods should you avoid? It's best to avoid raw or undercooked foods, unpasteurized dairy, and fish high in mercury. These foods can pose a risk to your developing baby. Week 4 of pregnancy is an exciting and important time. You're starting your journey into motherhood, and while the symptoms can feel overwhelming, it's all part of preparing your body for the months ahead. Focus on staying healthy, getting rest, and staying positive as your baby continues to grow. Thank you for watching. If you found this video helpful, don't forget to subscribe to our channel for weekly updates on pregnancy symptoms, tips, and advice to support you on this incredible journey. Be sure to like, share, and leave your questions in the comments below. We're here to help.